So in today's video, we're gonna walk you through how we get paid as healthcare travelers, because it's very different than how you get paid as a full-time employee. And it all starts with the bill rate. And so that's what we're gonna dig into on this video, because once you know that and understand that, then it really helps set you up for success and helps you make the most money moving forward as a traveler. So let's get into it.
Let's do it.
It's my life. It's my life.
We are Kim and Erran G, and we also have Mimi LaRue, who's usually on the ground stirring up trouble, but today she's being good, so we let her in the video. But this channel is all about educational resources, inspiration, and lifestyle tips for healthcare travelers. So if you are new here, welcome, and make sure you subscribe, because we put videos like this out every single week, along with travel videos, inspiration videos, and everything that you need to know for your healthcare travel journey.
So the bill rate is a term that you're gonna hear thrown around a lot in this industry, and we didn't even know what that was in the beginning.
No, we were just like, okay,
oh, sure,
cool.
Whatever, yeah. And a lot of travelers don't, and so we're gonna walk you through exactly what a bill rate is and what you need to know about it.
So the bill rate is set by the hospital. That is the number that the hospital is willing to pay for a traveler to come in and work for them for the contract. So for the sake of numbers, for just the easy math, let's say the hospital says, all right, we'll pay $100 an hour for a nurse to come in, or an OT or a PT or a radiology, IR, ultrasound, to come in and work that contract. What the company will do is they will actually take that $100 an hour, they will times it by the numbers of hours a week that we work, so either 40 hours a week or 36 hours a week based off of what you're scheduled to work, and then they will times that also by the number of weeks worked in the contract. So let's just say it's a 13-week contract. Well, that number will come out to, let's say, $52,000, right? So now that $52,000 is put into a pot. We're gonna use our little globe here because this is a traveler's channel. And so now that $52,000 is put in there, and that's what you're gonna have to work with your recruiter to break up your pay package.
Okay, so now this pot of cash, this $52,000, we're saying, again, based off the $100 an hour that the hospital was willing to pay, $52,000. This is a big pot of cash. I wish that this was all the money that we got, but unfortunately it doesn't work that way, because there's a lot of people that have to get paid out of this pot of cash, okay? But this pot here is the hospital's, like, I'm not paying any more money. I'm giving you this, y'all figure it out. You pay your people, you pay your company, you pay all the things, and that's all we're giving you, okay? So what actually comes out of this pot? So before you even see your pay package, they have a pot, and first they're gonna take out their profit margins.
Bye-bye. Oh.
Oh, okay. So the company has profit margins. They're a company, they have to make money. Next, your recruiter's gotta get paid, right? They've been doing all this work for you. They're your partner in crime. They help you land all these jobs. They've gotta take their cut.
Bye-bye.
So they're getting their money, okay? And that's gonna vary too, depending on the company. Next, it's a business, right? The travel company you work for, it is a business. So they have their own bills. They have to keep the lights on. They have to pay their employees. They have to do all the things a normal business would have to do to keep things rolling, right? So we're gonna take out some money for them. And then also they have to pay taxes. Again, going back, this is a business. So they have to pay payroll taxes, Medicaid, Medicare, Social Security, all the things, right? So there goes that. Here goes insurance, right? They have to pay for your insurance. They have to pay for all these things that come off the top. And then the last thing is, or not really the last thing, but another big thing is, every time you start as a traveler, there's upfront costs, okay? So you have to get a TB test or a physical or a drug screen, or sometimes you have to get a flu shot. There's lots of things that you have to do to go through orientation before you can actually start the job. And guess what? The company is paying for that, right? But it's coming out of that pot of cash. It's coming out of that because they have to allot money on the side to front that money, okay? So Everything's coming out of the pot. There's only a few little pieces in here.
VMS too.
Oh, thank you. Okay, there's a lot to remember. And a VMS, which we won't get into on this video, but it's a system that some hospitals will go through to get travelers. It's a third-party system, basically. And so they'll take a cut sometimes, and that could be like 3 to 5%, just depending. So they're going to take their cut too. So yeah, we only have like 2 little pieces of paper. And now this is going to become your pay package.
So now that what Kim said is all in this pot, everything is scattered all over the floor, it's in the company's account, you're left over with this. And now that's when you're going to sit down with your recruiter and really have your pay package broke down. So there's mainly 2 ways, there's 2 major sections that you can break your pay package down into, and that is taxable wages versus non-taxable wages. And the taxable is going to be your hourly rate for you to work, and or your call, overtime, and holiday pay. That's what I was trying to say. So call, hourly rate, OT, and holiday pay. Those are the things that are taxable, right? So then you have your non-taxable, which is going to be your housing stipend, your meals and incidentals, your per diems, your travel reimbursements. Those are all non-taxable, right? Now you have everything ready to go with your recruiter. So that's where you can actually start breaking it into how you want that pay package to look based off of your lifestyle.
So just based off what Erran just said, I just want to add, because I think it's important to understand that your stipend, so all this tax-free money that you qualify for as a traveler, if you have a tax home, is not considered income, okay? It's not considered income. It's a stipend, okay? It's a reimbursement. And so if you were trying to get a loan or or a credit card or trying to put money into Social Security, it goes off what your taxable amount is per hour and not based off your stipend. So we might make, let's say, $100,000 a year, but we're only taxed on, say, $30,000. Again, I'm just throwing numbers out here. So they look at, oh, she makes $30,000 a year because the rest isn't considered income. All right, so a couple of important things to know and to understand is, number one, the bill rate is something that is important for you to understand, and that's why we created this video for you, but it's very common for your recruiter not to tell you what that actual number is. It's just a thing. Most companies have a policy and they're not able to tell you, and it just is what it is. And so knowing that if your recruiter isn't telling you, most of the time they're not being shady. It's just they just can't tell you. Okay. Number 2 is that the bill rate is going to go up and down, right? And so your pay package is based on the bill rate. So the higher the bill rate, the more money you're going to make. The lower the bill rate, the less money you're going to make. And the bill rates can be set for all different reasons. So for the modality that you work in, or the location, or the need, right? So right now we're in a time where we're in a crisis, and so the need for nurses and respiratory therapists are through the roof, and the bill rates are through the roof. It's insane. Some nurses are making like $6,000 a week because these hospitals are willing to pay such high prices for them to come in, right? So it really just depends. So you could work a contract where you have a higher bill rate and you're making $2,000 a week and you're like, hell yeah, this is amazing. And then you take another contract somewhere, say Hawaii, and the bill rate's a little bit lower. And so you're making $1,700 a week, but you're loving where you are in Hawaii and all of the things. So the bill rate is what's going to set the tone of how much you're going to actually make per week, and it will change depending on lots of different factors.
Okay, so the last thing we'll leave you with is what I really find interesting about being a traveler is, you know, we did explain earlier about the fact that you have your hourly and your stipends, but what's really cool is it's almost like a chessboard as well. You can arrange that pay package how you see fit. You can not do travel reimbursement and put it into your housing if there's room. There's all different ways to play with this, but understanding why and how that works is really what sets you up as an empowered traveler. And that's why, one, we have an entire module on how to do this as in traveler school, because it's a skill that you can learn. And it really is my favorite part about when we get presented with a pay package, is being able to talk to my recruiter and be like, I want this here and this here, And as long as everything is legal and it's in the right spot, you're good to go, everybody's happy, and you end up with a great pay package that you feel great with.
So we will leave it at that today. If you enjoyed this video or got any kind of value from it, please give it a thumbs up. Leave us a comment below and let us know what topics you'd like to hear. If you have anything you want us to chat about, we can do a video. In the meantime, make sure to head over to our Facebook group, Travel Life Freedom and Scrubs, and check out our online course for travelers for more resources, tips, tools, and support to help set you up for success as a traveler. All of that you can find in the description below. And make sure to subscribe because we do new videos every single week. We'll see you next week.